Hi everyone. Welcome back to What I See. Today, we're discussing something crucial for every Indian family to know about: Human Metapneumovirus, or HMPV. This lesser-known virus is causing a stir worldwide, and we'll break it down for you, focusing on its impact here in India. So, let's get started. HMPV, or Human Metapneumovirus, is a respiratory virus first identified in 2001. It's part of the same family as RSV, or respiratory syncytial virus. HMPV primarily affects the respiratory system, causing symptoms like fever, cough, and difficulty breathing. It's especially concerning for children, the elderly, and those with weakened immune systems. Human metapneumovirus, HMPV, is typically not fatal for healthy individuals, but it can pose significant risks for certain groups. Here's a summary of its fatality and risk factors. General population. For most people, HMPV causes mild respiratory symptoms, similar to the common cold. Symptoms include cough, fever, nasal congestion, and, in some cases, shortness of breath. High-risk groups. Infants and young children. Severe infections can lead to bronchiolitis or pneumonia, which may require hospitalization. Elderly. With weakened immune systems, older adults are more likely to experience severe complications. Immunocompromised individuals, those undergoing chemotherapy, organ transplant recipients, or individuals with chronic illnesses are at higher risk. People with pre-existing respiratory conditions like asthma or chronic obstructive pulmonary disease, COPD, can worsen during HMPV infections. Fatal cases. Fatalities are rare but can occur in vulnerable populations, especially if the virus leads to severe complications like pneumonia or respiratory failure. Lack of timely medical intervention, especially in areas with limited healthcare access, can increase mortality risks. Global data. HMPV does not have a high fatality rate compared to other respiratory viruses like SARS-CoV-2 or influenza. In regions with underdeveloped healthcare systems, mortality rates may be higher due to delayed diagnosis and treatment. Recent reports indicate a notable increase in human metapneumovirus, HMPV, infections in China, particularly among children under 14 in northern provinces. Key points. Prevalence. HMPV accounted for 6.2% of positive respiratory illness tests and 5.4% of related hospitalizations in China during the week of December 16 to 22, 2024. However, it can lead to complications like bronchiolitis or pneumonia, especially in young children and individuals with weakened immune systems. Government response. Chinese health authorities have acknowledged the rise in respiratory infections, including HMPV, but describe it as a common winter occurrence. They emphasize that the current situation appears less severe and widespread compared to previous years. Public concerns. Despite official reassurances, social media platforms have circulated unverified videos showing crowded hospitals, leading to public concern. Authorities maintain that the healthcare system is managing the situation effectively. It's important to note that while HMPV is contributing to the current increase in respiratory illnesses, other viruses like influenza A, Mycoplasma pneumoniae, and COVID-19 are also prevalent. Health officials continue to monitor the situation closely, implementing measures to manage and mitigate the spread of these infections. Indian context. In India, where respiratory infections are a significant health burden due to high population density and limited healthcare access in rural areas, HMPV can exacerbate the strain on the healthcare system. Fatalities may be more likely in underserved areas, highlighting the importance of early detection, awareness, and prevention strategies. In India, respiratory infections are a significant public health concern due to high population density and diverse climates. HMPV thrives during cooler months but can spread year-round in crowded areas. According to recent studies, respiratory infections contribute to a large portion of hospital admissions in children under 5. Understanding HMPV is essential because it often mimics common colds, making diagnosis tricky. Diagnosis typically requires specialized tests like RT-PCR, which detect the virus in respiratory samples. Unfortunately, these tests are not widely available in smaller towns and rural areas in India. Prevention is key. Since there's no specific vaccine for HMPV yet, simple practices can make a big difference. Wash your hands regularly, avoid close contact with sick individuals, and wear masks in crowded places. Supportive care, plenty of fluids, fever management, and oxygen support in severe cases. In India, access to healthcare can be challenging, so early intervention is critical. The Indian government has been working on improving healthcare infrastructure, especially in rural areas, but awareness is equally important. Educate yourself and your community about respiratory illnesses. Schools, workplaces, and local governments can play a role in spreading awareness about HMPV and promoting preventive practices. Together, we can reduce its impact. That's all for today's video on HMPV and its relevance in India. If you found this information helpful, make sure to like, share, and subscribe to What I See. Together, we can stay informed and protect our loved ones. Take care and see you in the next video.